In this video, we are going to show you a very classical clinical sign which is known as Stridor. Inspiratory stridor, which is a medical emergency usually. Stridor usually suggests an upper airway obstruction, especially after the above the vocal cords. So what is important here is we have to identify bedside clinical examination, how to identify a stridor, because sometimes it is confused with wheezes. Now you see the person is, when the patient is inspiring, there is a raspy noise. Lambi saas gaya. And you can see inspiratory suprasternal muscle retractions, especially during inspiration. The suprasternal area is retracting and there is a sound during inspiration. So this is classical stridor, and it is one of the medical emergencies. Though acute and chronic cases of stridor, causes of stridor exist, but every case of stridor should be investigated, because sometimes it is required that the patient should undergo tracheostomy, emergency tracheostomy.